Welcome, LEAs. The Office of the State Superintendent of Education, or OSSE, has put together a brief training to provide a high-level overview of the Health and Physical Education Assessment, or HPEA for short. I'm Rebecca Harnick, and I work with the Division of Health and Wellness at OSSE. Today we'll walk through the assessment timeline and roles and responsibilities of LEAs for administration. I'll also cover the tools you'll use to plan for, administer, and monitor the assessment. These tools include Box, eSchoolPLUS, Integrated Data Submission, or IDS, Alchemer, formerly known as Survey Gizmo, and Click. We'll go into more depth on each of these tools shortly. Let's start with a high-level overview of the Health and Physical Education Assessment, which I'll call HPEA for the rest of this training. HPEA is a requirement of the District of Columbia's Healthy Schools Act of 2010, or HSA. HSA requires OSSE to collect and report student performance on DC health and physical education standards. HPEA is an annual assessment of health and physical education knowledge in grades 5, 8, and high school, specifically during the year in which health class is taken. The assessment was canceled in spring of 2020 and spring of 2021 due to the coronavirus pandemic, so this will be our first year administering the assessment since 2019. The data are used for a number of sources, including HSA reporting, tracking progress on performance to health and physical education standards, driving targeted investments through grants, and identifying needs for technical assistance supports and community-based organization partnership based on the needs identified by the HPEA. This is the assessment blueprint, which has not changed since last cycle. You're seeing grade 5 here, but the blueprint's the same for grades 8 and high school. The 7 categories listed here correspond to health and physical education standards. The survey tool, Alchemer, randomly selects 3 questions for the student to answer from each category, for a total of 21 questions. The 2022 HPEA must not be administered remotely for students learning virtually due to concerns around test security and impacts on data reliability. If full classes or grades are in a virtual posture due to COVID-19, the HPEA assessment should be postponed until a majority of students have returned to the school building. For this reason, OSSE recommends that LEAs select test dates that are earlier in the window to allow for time to reschedule classes if needed. If individual students are out due to illness or COVID-19 exposure, LEA should reschedule students to take the assessment on an individual basis. Students with an approved COVID-19 medical consent and certification for distance learning will not be required to participate in the 2022 HPEA. For this assessment, students will not be asked to submit a secondary exemption letter from a physician and a parent or guardian to exempt them from testing, as statewide assessments and other assessments are doing. HPEA, in this scenario, OSSE encourages but does not require LEAs to invite students with an approved medical consent and certification for distance learning to the school building to take the HPEA in person. If students with this exemption test in person, LEAs are expected to provide reasonable accommodations for testing these students' safety. For example, offering for them to take the assessment in a separate room or to participate during alternate hours. Proctors should engage with their LEA HPEA POC to ensure a plan is in place for these specific students if they are testing. Next, I'll cover the assessment timeline, important dates, and responsibilities. The 2022 HPEA window this year is April 4th through June 24th, 2022. March 11th will be the preparation deadline for several key HPEA items, and I'll walk through these briefly for you. These materials and their respective user guides, when necessary, have been emailed to LEA assessment managers, data managers, and health points of contact, and they're also in the LEA Look Forward. This cycle, a new role has been created for HPEA points of contact to streamline engagement with each LEA. Each LEA should designate an HPEA POC to take the lead on the HPEA coordination with OSSE and your LEA, as well as individual test assessment proctors at each school to ensure they have all necessary materials and supplies for preparation. To assign this contact in eSchoolPLUS, LEAs can refer to the guide assigning points of contact in eSchoolPLUS for their reference. Next, we'll ask that LEAs provide their planned HPEA administration timeline within the April 4th through June 24th window in the Microsoft form that's been shared by OSSI. And finally, by March 11th, we ask that you identify the high school students who have been enrolled in a health class at any point during the 2021-22 school year in the IDS tool. The IDS user guide is available on OSSI's webpage as well. By March 24th, we'll also ask that LEAs provide an Excel file outlining all planned accommodations for students with disabilities with individualized education programs, IEPs, or Section 504 plans. Use the OSSI provided template, which is available on the OSSI HPEA webpage and through the LEA Look Forward and email, and upload that file to Box. This slide outlines the important dates for the months ahead. The first row is all of the items that were just mentioned in the prior slides and are due to OSSI by March 11th and 24th. March 24th is also a key date for when HPEA POCs can download students' test tickets from Box and distribute test tickets to schools along with a Proctor script and any other needed materials for assessment administration. As a note, grades 5 and 8 test tickets are created with snapshots of elementary and middle school enrollment as found on SLED on March 15th, 2022. High school test tickets are created with high school class rosters identified by LEAs and IDS. If any students moved schools or started as new students between March 15th and the start of your assessment, unfortunately, OSSI is not able to create test IDs for those students. The next important date comes a minimum of 10 days before your planned HPEA start date, which is to test to ensure that Alchemer, the survey tool platform, is not blocked on your school networks. At least 5 days before the assessment, ensure that schools have sent home letters offering parents the option to exempt their children from completing questions about sexual health. We'll cover that more shortly. And finally, from April 4th through June 24th, 2022, or whenever your LEA completes the assessment, track HPEA completion regularly using the Click LEA stream. Follow up with schools to ensure 100% completion before the assessment end date. We've discussed the school HPEA POC. We'll also need to discuss school-based health assessment proctors for administering HPEA. These individuals' roles include confirming that the assessment URL is not blocked by the school's network, ensuring appropriate accommodations are available for students with disabilities and students with a COVID-19 medical consent and certification for distance learning if they are testing, confirm and communicate assessment dates, times, and locations with LEA level HPEA POCs, and obtain students' test ID tickets from the LEA POC, distribute sexual health exemption letters and track their receipt if returned, and review and follow the health assessment proctor script to administer the assessment. As I mentioned, the sexual health exemption letter is posted on the OSSI website, and that's available in English, Spanish, Amharic, Korean, Vietnamese, and traditional Chinese. The template is in Word, so you can update the date as circled here, according to your LEA or school's plan for administration. As noted, this form should be sent home at least 5 days before administration. One important note here is that this is a passive consent. Parents who do not wish for their student to answer questions related to sexual health will return the form indicating so. Parents who are comfortable with their child answering these questions do not need to take any action. As I mentioned, a number of tools will be used for the HPEA assessment. This slide is a high-level overview, and then we'll go into more depth in each of the tools in just a moment. Also, as we discussed, this cycle of HPEA, we're introducing 2 new tools to help prepare for the data collection process. eSchoolPLUS will be used to identify an HPEA point of contact for your LEA, and the Integrated Data Submission tool will be used to share high school students currently enrolled in a health class. As in prior years, we'll also use the LEA to OSCE folder and box to upload your accommodations plan to OSCE. For administration of the assessment, this will take place, as mentioned, through the Alchemer platform, which was formerly called Survey Gizmo. We'll be monitoring participation rates, which takes place through Click, and in real time, LEAs can review assessment scores and monitor school completion through Click. And finally, retrieving the assessment results takes place again in real time through the Click platform. Now that we've shared that high-level overview, we'll dig into each of the tools I mentioned. Box is how OSCE securely transfers information between OSCE and the LEA assessment coordinator. This includes how LEAs upload student accommodations plans and how OSCE shares test tickets with LEAs for individual student access. We never want to email personally identifiable information, or PII, back and forth, so this is really ensuring a secure approach. The next few slides will share details on how that interface works. If your LEA's appropriate HPEA contact doesn't have access to Box, please contact me at osce.schoolhealth@dc.gov. Once OSCE extends access to a new user, that user will receive an email from OSCE, which they should open and follow a link to the system to confirm. For users who may already have access to Box but not specifically the HPEA folder, please also contact me. Once access is granted to an existing user, they'll see a notification in their Box inbox, which they'll need to open and accept. This is an example folder structure in Box. There's no school level data here, which is why I'm sharing this as an example. This is what you'll see once you log into Box and view your two main folders in the system. There's an LEA to OSCE folder and an OSCE to LEA folder. The LEA to OSCE folder is where you'll upload materials that contain student-level personally identifiable information, PII. In this case, I'm referring to the accommodations plan. The OSCE to LEA folder is where you'll download materials that contain student-level PII, and that's the HPEA test ID tickets. You'll use the LEA to OSCE folder to update your accommodations plan to OSCE by March 24th, 2022. The upload button is shown here in the upper right corner. Similarly, to download test ID tickets in Box, first navigate to the OSCE to LEA folder and then the HPEA folder. You'll use the OSCE to LEA folder and the HPEA folder to download your test ID tickets and a list of all student names for the assessment. These downloads, as I mentioned, will be available beginning March 24th for you to print and distribute to assessment proctors according to the timeline you've established for your LEA's assessment. As I mentioned earlier in the training, OSCE is centralizing LEA's POC collection in eSchoolPLUS to minimize multiple sources for LEA contacts. OSCE will send communications to the eSchoolPLUS POCs. Also, access to applications like Click and Box and others are granted based on the eSchoolPLUS POC rules. This assignment can be done by logging into the eSchoolPLUS platform by using your username and password. LEA data managers have the ability to add staff into eSchoolPLUS. If you need access, if the LEA data manager needs access, please submit a ticket in the OSCE support tool. The guide for assigning points of contact in eSchoolPLUS can be accessed through the email communications that have been shared by OSCE. For LEAs specifically serving high school grades, this particular task can be disregarded for only middle or elementary school LEAs. We will identify high school students who have been enrolled in a health class at any point during the 2021-2022 school year and are therefore required to take the HPEA using this integrated data submission tool. The IDS user guide is available on the HPEA webpage. Once you've logged into this tool, you can download the template for high school students by clicking the download button. When you've populated all content, click Upload to share the student data. If any errors are identified, the tool will share that information and a second upload can take place. Now I'll provide an overview of Click. CLIC is used for two main purposes during the HPEA administration. It's used for monitoring completion rates during the assessment window, and after the assessment is complete, it's used for reviewing results, the percentage correct, after the assessment closes. The data manager, as well as the health assessment points of contact, will have access to the HPEA tool and CLIC by April 4th when the assessment launches. Contact me at aussie.schoolhealth@dc.gov if you'd like to request additional users to be added to this tool. The HPEA POC should log into CLIC regularly during your assessment window to monitor completion rates and follow up with schools to ensure participation. This is the login screen for CLIC. Once you've logged in, navigate to the stream for HPEA on the left side of your screen, and you'll see a number of items pop up. Because HPEA had to be canceled for the last 2 cycles, I'm using an old CLIC screen here for demonstration. However, once the tool goes live, you'll be seeing school year 21-22 health and physical education assessment, and that's what you'll click. To monitor participation for your LEA, click Completion and Participation. Once you click that, you'll see the overall completion rate. In this example, we can see it broken down by 5th grade, 8th grade, and high school students. Below, we can also see exemption for the sexual health questions by grade. Going back to the main page, we're also able to view student-level participation. LEAs can view the subsections of the report and the schools in each of the subsections, as well as the overall completion percentage. LEAs can also review the results summary of the assessment. For this LEA, where there are multiple school campuses, we can see the overall scores in each subsection of the report, for example, alcohol, tobacco, and other drugs, or mental health. You can see that it's feasible to look at school year, school name, and grade. The final section of this training is a brief overview of the survey platform, Alchemer. At least 10 days prior to the assessment administration date, ensure that the assessment site can be accessed on the computers that will be used to administer the assessment. This is the link to the web page that will be used for the assessment. This platform is compatible with the latest versions of Google Chrome, Mozilla Firefox, and Microsoft Edge. Once you've navigated to the HPEA webpage, to log a student into the Alchemer platform, the proctor will enter the student's assessment ID found on the test ticket, which is in box A here on this illustration. If a parent has requested exemption from sexual health questions on the assessment, the checkbox B at the bottom of the page must be selected. Once this action is checked, the students can, by the health assessment proctor, the students can click on the next button. There's a verification step here. If corrections are needed, you can click back. If all of the information is correct, click next. Once you select next, you won't be able to go back to the first page again, so proctors must be sure that this information is right before moving past this page. After the student completes all questions and reviews their answers as needed using the next and back buttons, the student will see a page indicating the conclusion of the assessment. The student must click Submit on this page to submit their answers. This is the end of the assessment, and it verifies that the student has completed it. You'll see that 100% is marked at the bottom for completion of the assessment, not their scores. And that's the end of the Alchemer tool. Thank you so much for joining this training today. We appreciate your partnership on this important assessment. If you have any questions, please refer to Aussie's HPEA webpage. The URL link is available in the upper right here. The webpage includes the LEA guide for the 2022 HPEA, the health assessment proctor script, information on high school student submission through IDS, templates for accommodations, and sexual health exemption letters. We look forward to collaborating with you to attain full participation in the district. If any questions come up for you, please don't hesitate to reach out by contacting us, aussie.schoolhealth@dc.gov. Thanks so much.